This is Orsi, official old guy at oldguytalkstome.com, a podcast dedicated to helping older guys create kick-ass lives for themselves and those that they love. It's for women too. Each week, I bring you a special guest to help you create that life that you imagine for yourself and those that you love. We talk anti-aging medicine, personal growth, relationships, and sex, vices, and other topics that many don't want to talk about but need to. Just because you're getting older doesn't mean you have to be old. Also, if you want to know 3 ways to get laid more frequently without begging, go to oldguytalks.com and opt in. When you do, you're going to get my informative video on 3 simple things you can do to get laid more frequently without begging, so you don't have to turn in your man card. And ladies, you may want your man to know these things, because I think you'll like it too. Additionally, you'll be notified weekly when a new podcast episode is ready for you to consume. Periodically, I will share with you other stuff that will help you create that life that you want for yourself and those that are important to you. Don't want to miss anything? Be sure to subscribe, share, and review this podcast. Did you know that there are 76 additives that have been approved by the FDA that can be added to wines? You want a wine with shit in it that may not be good for you? Well, there is an option for wines that have been produced naturally, organically, that have been tested, that have no sugar. And when they don't have any sugar, that means that they're ketosis and intermittent fasting friendly. These wines have been produced with a great deal of care on small farms and are available to you. How do you get them? Find out by going to www.oldguytalks.com/dry farms, all one word with an S, and find out more. And with your initial order, you can get a bottle for 1 penny. That's right, a bottle for 1 penny. And they taste great. They taste great. Don't wait, don't hesitate, don't procrastinate. Get those wines now. This is Orsi, official old guy at oldguytalkstome.com, a podcast dedicated to helping older guys create kick-ass lives for themselves and those that they love. And part of that, well, it's your health and your hormones, both for guys and girls. They're all important. And today we have an expert in that area, Dr. Erika Schwartz, MD. And I had a chance to hear her speak at the World Peptide Conference, which is a huge meeting. It's a huge meeting. It's almost as big as Comic-Con. Yeah. Yeah. But she started her career at age 28 as director of emergency medicine at Westchester County Medical Center, University Hospital in Valhalla, New York. She practiced internal medicine in Westchester County, New York for 15 years. During this time, she became an expert in nutrition, diet, exercise, and their impact on disease and prevention. She also learned the importance of the doctor-patient relationship as the foundation for good health. Dr. Schwartz developed interest in extensive clinical expertise in the use of bioidentical hormones for symptoms of hormonal imbalances at all ages. She founded Erika Schwartz MD PC in 1998, Irvington Medical Associates, National Hormone Pharmacy in 2002, Age MD in 2006, and Better Health Initiative for Nonprofit in 2007. Most recently, she founded Evolved Science LLC in New York City, an elite concierge medical practice focused on the prevention, hormones, peptides, IVs, and aesthetics in 2014. And she's published the new hormone solution, Don't Let Your Doctor Kill You, and the intimacy solution. She helps educate physicians and the public in the areas of hormones and anti-aging medicine. Her goal is to reach as many people as possible to help them understand their bodies and to take responsibility for their health, their life, and success, and have a fullest life possible. And so welcome.
Thank you. Listen, that sounded a lot better than anything I've ever would have put together. So I was listening to it and saying, well, is that me? That's interesting.
Yeah. Well, this is a kind of paraphrase from your LinkedIn profile.
Really?
Yes.
That should tell you I didn't do that one.
I did not do mine either. So, and also we're going to have links to her blog and to her website in the show notes, so you don't have to worry about writing them down. So I always like to ask this question to my guests: what is the most important thing you've done today?
Today,
Yes.
well, we just moved. So the most important thing I did is right behind you is I was putting together the library that I have. I wasn't even intending on doing it, the podcast with you with it in the background, but we have no service here. So this was the closest I would come to it. So I was just enjoying going through the books that I have. I keep, because everything's online and everything's
Sure.
so there are very few books that are actually books per se.
Yeah.
So what I was enjoying doing today was going through them, and these are some of the books that I've kept over the years. And so it was a great day because it was like kind of remembering what impact particular books had on me and when I got them. So it's been a great day, and it's really sunny and beautiful. And we moved to a very nice beach town in Connecticut. So it's really nice. So now tomorrow I'm going back to the city to work.
Oh, okay. Well, that sounds like a good day. Sounds like a good day so far.
Oh, amazing. Amazing day. Yes.
So before we get into talking about hormone replacement, I want to ask you, what's the difference between seeing a doctor like yourself or someone who's a doctor that's in the sick care system?
Well, my goal is to help you to feel the best you can feel. My goal is not to label you with a disease. My goal is to make your life the best life possible today and not worry about the fact that giving you a label will ruin your life, which is what conventional medicine does. And I've been a conventional doctor, and I can say that because I am a conventional doctor and I was trained in conventional medicine. And I did that for almost 20 years of my life. So I could tell you that my goal is to keep you healthy and to have you, people use the term optimized like a lot, and nobody really knows what it means, but everybody's an individual, and it's making your life the best life possible today.
Yeah, I think so. I think I think what a lot of people don't realize is that the private equity groups have bought up a lot of medical practices, and so those doctors are not. First of all, they're not working for themselves. They're probably reporting to an MBA, and they have all sorts of quotas that they have to fill. Yeah, so and that's why you only get 15 minutes with them. If that.
Which is a shame, because you know what? I think it takes away from whatever doctors could do to help.
Mm-hmm.
So, I wrote this book that you mentioned, Don't Let Your Doctor Kill You. And it's not against the doctors. It's actually trying to help doctors realize what they're doing is not helping because they're really not working for the patient. And if there is anyone else in that examining room besides you, the doctor, and the patient, then you're not going to help. And there are way too many people. It started out with malpractice, and there were like all these lawyers in there. Then it was insurance, companies coming in. And now you have the new, owners of the healthcare system. So how could that help the individual? How's that going to help anybody?
No, not at all. Not at all. What are, everybody's talking about, they talk about lab values. And people seem to think that lab values are like, the gospel is written, it's a sacred word. Talk to me about how you view lab values.
Well, unfortunately, again, in the conventional traditional sense, we use lab values the same way we use results of CAT scans, of PET scans, of MRIs, of ultrasounds, of any technology that we can use to make a diagnosis, to put a label on something. So lab values really represent a moment in time. So a moment in time, it's just like we're not dead. So as long as we're alive, it's just a moment in time. Whatever the result is this moment is not going to be the same result a few moments from now. It's going to change. So to use the results of a blood test or of a CAT scan to say that the problem you have is connected to the result of the CAT scan, it's kind of being unfair and not doing justice to the individual, because you're making connections that don't really exist. in the conventional world, so when I was running a trauma center and I was running ICUs, you had results of bloods that actually helped you titrate or change what the number, the electrolyte was, or things, blood sugar level or insulin levels, things that would actually affect life or death in people who were in the intensive care units, who were really sick. But to take that number and apply it to you and me, who are kind of sitting up today and talking about optimum health and talking about living the greatest life possible, is doing a disservice and not having anything to do with reality, because each one of us is different. Blood tests are about public health, and I have nothing against public health. I think public health is really important. But when you talk about individual health and individualized health cannot be public health. There's a huge discrepancy between the two. We're politicizing it instead of explaining it. And it's a problem, because the results of a blood test are only as good as they apply to the clinical situation of the individual whose blood test you have taken at that particular point in time.
Yeah. I think also the one of the tests that I'm most familiar with is testosterone, because I've been on testosterone for 25 years, way before it was really popular. My PCP was telling me all sorts of bad things are gonna happen to me and everything else, and I said, I don't think so. But
PCP came in 1939 when when Dr. Huggins wrote about testosterone and prostate cancer. So that's like a little backwards, just a
little bit backwards. But I think the most interesting thing, because my doctor has me get my blood values twice a year, just so that everybody's happy. And I just noticed that on LabCorp, the top range dropped from 1100 to 960. Which is about a 10% drop. And I was talking to another practitioner who's in the testosterone. He spends most of the time treating men with testosterone. He said, Oris, that the high range was about 1500, not that far long ago. And so we're really measuring the average of unhealthy people.
Yeah. No, we're not really measuring. Blood tests is kind of, I don't know, people ask me, and when I give talks about it, and I talk about thyroid and things like that, and they go, what do you do with the results? And this is what I do with the results. If the patient's doing great, I ignore them. If the patient's not doing great and they need more, I'll give them more. If the patient's doing great and the results are wrong and the results are saying that they're not doing well, I just listen to the patient. Because at the end of the day, the patient lives in that body, not the result of the blood test that I obtained on that particular day.
Mm-hmm. Yeah. I think thyroid is also the one that's really big in terms of people just like being so adamant about being in that range and the numbers.
Yeah, and you know what? And there's a huge argument that goes on between the American Endocrine Society and people like us who actually treat patients. And it's all about, numbers being more important than how patients are feeling. And I think the clinical picture is a lot more important than a number is.
Yeah, I know that on a few occasions I've gone off my testosterone, and within about 8 to 10 days, my wife notices. And she goes like, you become depressed, wishy-washy, and so it's an interesting phenomenon, but it happens. So I want to talk about hormone replacement for women a little bit, and there are several hormones, and you can maybe list them off and talk about it, and we just kind of talk and then start talking about what is the how do these hormones affect inflammation, or get into brain fog and a few other things.
Well, actually, hormones work together. So not one hormone represents, does one thing. Some of them are more adept at doing certain things than others, but they're like an orchestra. There are hundreds, thousands of hormones that work together. And the goal is to have us in balance. And if the hormones are in balance, it's like an orchestra that sounds beautifully and that's in tune. And if the hormones are not in balance and some of them are off, then you have certain sections of the orchestra that are not sounding right. So the goal is to really balance your hormones. And we've known this for many, many years. I mean, I'm talking about 4 or 5 decades, actually. Unfortunately, we're not doing very much about realizing that you have to really address each hormone separately and then see how they work together instead of putting them all together. So people are getting trained more now than they used to get trained in hormone treatments, but they still will put, like I see patients every day and they'll come in and they'll give me a pump with creams that are, compounded that have estradiol biased, which is estradiol and estriol, progesterone, DHEA, pregnenolone, God only knows what. And then you wonder, and testosterone, and then you wonder how you're going to adjust one of those hormones when you need to adjust one. So I did this for the past, I've been doing this for about 27 years at this point. So what I did from day one is I did not follow that kind of philosophy. What I did is I started working with one thing at a time. So yeah, you may have more stuff you're taking, but you know that it's going to work well because I can adjust them. And if they're well adjusted, patients come in and they say, oh, it's miraculous. It's not miraculous. It's just kind of common sense that works. Okay. So testosterone is one of the lucky ones because they don't get mixed up the way you do with women in general. Sure. As I was saying to you, the estradiol together with the estriol, which makes no sense because it only occurs, you only have pregnant women who make it. So why do you have it all together? The DHEA, which by the way is a precursor to testosterone. So if you're giving testosterone, what are you doing with that? Pregnenolone, which is another precursor, which you probably don't need. There's so many combinations of things, and it's much easier to work with individual hormones, and thyroid being a very important part of the conversation.
Yeah. So, for now, my understanding is, and obviously you'll tell me if I'm incorrect, that treating guys is a lot easier than treating women.
You know what? It's interesting that you're saying that. It's easier because we probably know a lot less about guys than we know about women, and guys are much easier. Like you give them testosterone, they'll do fine. But, we work with peptides and all kinds of other supplements, which will help guys a lot more. I think we're discovering a lot more stuff now. There's a lot of data coming out. With women, it's always been difficult because there's no FDA approved testosterone preparation for women, which has done a disservice to women because it actually works really well. There's been, since 2002, when we had the Women's Health Initiative go bust, which was a really bad study, women were told that estrogen causes cancer, which is not true. There's not one shred of evidence that connects estrogen to cancer. Then, you had progesterone as a sidebar that one doctor made a big deal out of, which, yeah, it helps, but it's not as big as and as important as it was made at the time. And then you have thyroid, which is probably one of the top hormones with women when they start changing. The other thing is I wrote a book called The Hormone Solution. Now it's the new version of it is called The New Hormone Solution. And the Hormone Solution I wrote, and it's ironic how everything happens time-wise. It's all about timing. It came out in April of 2002, and the Women's Health Initiative went bust in April of 2002. So it became #2 on Amazon. So it was like the only book anybody could have. And what I had said in that book, and I was new at it, I've been doing it for maybe 5-10 years at this point, maybe 5 years. And what I was talking about is that hormone imbalances in women occur at all ages. So if you're a teenager, you have PMS, nobody even knows what PMS is really. You have acne, you have headaches, then you go in your 20s and you start, having babies, and then you have postpartum depression, and the treatment, of course, for postpartum depression, is an antidepressant, but it's actually not. It's actually progesterone and getting your hormones back in balance. Then I talked about, in your 40s when they become perimenopause, and I hate labels. I really hate labels. And so it's a time 10 years before you stop having a period. And in that period of time, women start gaining weight. Their estrogen doesn't work as well as it did. They don't ovulate the same way they did. And so their hormone balance becomes a little off. So if you know what you're doing and go in at that point, and we're talking about the women in their 30s and 40s at this point, then you're going to protect them from what happens next, which is menopause. So menopause, they start having hot flashes, night sweats, insomnia, etc. Now, what we found out since then, this isn't from 2002 on, by 2011, we knew that symptoms like hot flashes, the more hot flashes you had, the more likely you were to get heart disease. But nobody across the Atlantic, I mean, this was something that we learned at the International Menopause Society, which was in Italy, and it didn't cross the Atlantic because there was no reason for it to cross the Atlantic. And we found out that women needed hormones. The earlier you put them on hormones, the better. But in the States, we were still living with the aftermath of, the Women's Health Initiative that said, oh my God, hormones are bad for you, even though it had nothing to do with the hormones. Anyway, it was just a particular drug that didn't work that they had put into this. Anyway, so then what happened was that, so the next thing, so this is all part of the hormone solution. Now it's called the new hormone solution. And the next thing was really as you get past menopause and how to prevent diseases, chronic diseases of aging coming on. So that's when you're talking about hypertension, diabetes, chronic illnesses, arthritis, all these things that now, and it's so ironic because I feel like COVID made us wake up and face the truth, but we were trying to face the truth for 20 years before that, but didn't go anywhere. All these diseases could have been prevented, and they can be prevented. All you have to do is balance the hormones, teach people how to eat right, sleep, exercise, do all the stuff that you hear every day that you need to do to prevent diseases. And then you look at people who prevent disease and then they're in their 70s, 80s, 90s, and there's nothing wrong with these people. And then you go, what happened? Well, they're taking hormones. They've been on hormones since they were teenagers. And so with women, you're right, it is more complex, but it's not very difficult, especially you're talking to me who's been doing it for 26 years.
Sure,
So
sure.
I'm a little biased.
So let's mention a few things.
Sure.
Inflammation, brain fog, and osteoporosis and hormones.
Yes, what would you like me to tell you? Hormones in the right balance eliminate all of the above.
Okay.
So you don't, let's go to osteoporosis because that's a disease of chronic illness. It's a disease of aging, and it's a horrible disease. The problem with it is that hormones, when you're in your 20s, and whether you're a man or a woman, you don't have osteoporosis. I mean, I've never seen a 20-year-old with osteoporosis. I don't know if you have. And I've seen probably more than 50,000 patients at this point in my career. So the question is, what happens? Well, the answer is right in front of you. You lose your hormones. When you lose your hormones, you start losing your muscle mass, right? So once you start losing your muscle mass, you are unable to keep the strength in the bones. And so you need to maintain the bones by exercising and not by worrying about taking calcium, but rather by taking hormones and vitamin D and sitting in the sun. I mean, they're common sense things. So that's really osteoporosis. Now, when you're talking about any other issues, inflammation, well, what's killing us is inflammation, right? Cancer, heart disease, brain fog, all of these are signs and symptoms of inflammation, right? Well, inflammation is the result of not eating right, not exercising, not sleeping, not having your hormones there. So when you're talking about it, at the end of the day, you're talking about the same thing, which is balance your hormones, bring the hormones in, stop drinking alcohol, stop eating junk, start drinking water, and start sleeping. To get people to sleep at night is really unbelievable, because that's when everything gets rejuvenated, recreated. And people don't sleep. I mean, I was just talking to a patient this morning, and the guy is in his 60s, and he's got diabetes, and he's overweight, and he doesn't really exercise. And I say to him, listen, if there's one thing you need to do, one thing is go to sleep at night. He's like, well, no, I really like watching movies. And, with COVID, I didn't have to go anywhere. So what happened is that he doesn't sleep. Well, 3 hours of sleep are going to kill you.
Yeah. Yeah. My understanding is that estrogen is very important to having good sleep.
Estrogen is very important. Testosterone is very important. Thyroid is very important. And progesterone in women and in men is very important. So you want all of these things. I think that one alone is not going to do it. Also, what you eat. Like if you eat sugar at the end of the day, like people, having dessert, right? If you have dessert, you're going to get into trouble. Dessert, sugar will keep you up, and you're not going to be able to get the quality of sleep you need.
So, and then again, I want to touch a little bit on diabetes, weight gain, and stress in terms of how hormones help you there.
You know what? My computer is about to die. So let me find in my new house.
Okay.
I'll talk to you while we're doing this. Let me see if I can find where the charger went. Oh, I found the charger. So I found the charger. Now all I have to do is find a location that has a plug. And I saw a plug today while I was doing this. I have to find out where it was. Bear with me. Just ask me and I'll tell you what tell me.
That's okay. Oh, okay. So let's talk about kind of these three things: diabetes, weight gain, and stress.
Well, yeah, diabetes. Diabetes is probably the worst insult that we're giving to our bodies. Hold on, I have to move closer to that. I got you. Okay, now I'm charged. Great, thanks. So diabetes is something that, it's a disease of aging, and it's a disease of eating badly, and it's a disease of not sleeping and having no hormones. So diabetes comes from, initially we get insulin resistance. So our insulin is unable to get rid of the amount of sugar that we're eating. And, when we're watching this in movies and documentaries, we read it all day long, nobody seems to get it. The amount of sugar that we consume is ridiculous. And that amount of sugar is actually what causes us to develop insulin resistance. So our insulin can no longer clean up the sugar and push it into the organs. So then you become fat and you get diabetes. So diabetes is the kind of number one disease that will lead us to heart disease, brain fog, and all the diseases of chronic aging, including cancer. So when you're talking about diabetes, you have to realize that unless you have type 1 diabetes, which is a genetically developed, a genetic disease, and then you have to have it taken care of, you want to not gain weight. You want to be the same weight that you were when you finished high school. The problem is that we live in a society where most people spend their entire life yo-yoing. They're either high or low on the diet. There are all these diets that we're all talking about, which make no sense, because if you have to be on a diet, that means that you may lose some weight if you're lucky, but then you're going to need to go on a diet again, because when you stop the diet, you'll go back to whatever reason you had to be on the diet. So this constant yo-yoing is only making our liver, our pancreas, unable to process the sugar. And eating sugar substitutes, which, like, I don't know how many people know, but, Splenda and all the other sugar substitutes, when heated up, they turn into formaldehyde, which is really what is used to, to take, to embalm humans. So why would we be eating the stuff? Anyway, so people eat sugar substitutes because they taste even sweeter than regular sugar.
Mm-hmm.
So their taste buds become completely polluted and they
Sure.
need more sugar. So it becomes a big problem. So that's where diabetes comes in as the number one reason why Americans are sick and overweight.
Yeah. So and hormones affect also with the weight gain in terms of helping you maintain muscle mass. And is that correct?
Yeah, well, diabetes is caused by, well, obviously it's because we're eating junk, but also you're making hormones, leptin, and, that will increase your risk for diabetes. And the more these hormones are made, the more likely you are to become sick with diabetes and get the diseases, start getting overweight. And, there's a lot of issue, like people say, well, this person is overweight and so that's their life. But the truth is, I deal, I don't put people on diets. I mean, there, every week, every month, there's a new diet, and I'm sure you have someone else on your show that will tell you the value of the newest possible diet. But the truth is that everybody's different. And it's not about the diet, it's about what you're doing that is improving the quality of your body's ability to process nutrients and absorb them and use them to improve things. And you can be on intermittent fasting, you can be on keto, you can be on anything you want. If it works, good for you, but don't get off of it. Don't stop it. Stay on it. And don't go from being overweight to being underweight to being overweight and then think it's going to be okay, because it's not. And as far as muscle, what you were saying is muscle is probably the most important organ in our body, because we see that people who have muscle, and I don't care if they're 40 or 70, if they have muscles on their bodies, they're healthy. They move like young people. They feel like young people. It's not about chronologic age. It's actually about muscle age. It's how old their muscles are, how well used are their muscles, how much are they exercising. And it's all about, we used to make it all about aerobic exercise, and everybody had to run, and everybody was on the elliptical, and everybody was on the treadmill. And the truth is, what's turning out to be the truth is that it's all about resistance training. It's about how much muscle we can build. And the more muscle we build, and I'm not talking about, and it did start with bodybuilders, but most people are not bodybuilders. Most people don't even get off the couch. So you have to get people to realize that all you have to do is build muscle. And it doesn't have to be a huge amount of muscle. And it's not about BMI, which, that's the other thing. What's your BMI? If your BMI is normal, you're fine. Well, you can have a normal BMI and have zero muscle on your body. So you're heading towards being old and frail and fragile, and then you just break everything and that's it. Yeah. So again, a number, speaking of a number, BMI.
Yeah. And then the one I want to also talk about is, and I think this kind of surprises a lot of people, skin tone is can be affected by hormone therapy.
Of course. Yes. Yes. And I, interestingly enough, the first time I came across it, and I never forgot it, was this woman in her 30s who came to see me and told me that her skin was just falling off of her, and she was very upset about it, and she wanted to have help with it. And I had never heard of it. I mean, there was nowhere in medical school or in postgraduate training that I had learned anything about skin tone. And it turns out that collagen, which supports and provides you with the correct skin tone, the good skin tone, goes away the same way you get the wrinkles on your face, and everything else falls apart if your hormones are heading south. And the moment you put the hormones in, they actually start improving skin tone.
Yeah. Yeah, I think that's it's there's so many things about having your hormones in balance. And again, I'm a big believer of that. So I'd like to switch gears here a little bit, because you're an expert in peptides and stem cells and other things. How do you decide as a physician to start incorporating those? And what's the process? Let's say you have a patient comes in, and how do you work through with the patient in terms of incorporating hormones? And I assume that peptides and those kind of things come later, or what is the order?
It's very interesting because it's actually the patient who dictates what they want. And
Okay.
I listen to the patient. I think that what I start with is hormones. And I start with the hormones if they need the hormones. If they don't need them, then I'm not going to start with the hormones. I'll start with their diet, exercise, sleep, stress management. I'll start with whatever is, I listen to them. The first thing I do is listen. I spend the first hour and a half with them, asking them questions about themselves. And 20 years ago, 25 years ago, when I started it, and I would say to people, tell me about you, they'd be like, what? What do you mean by that? Well, and it was always like, tell me about you so I can understand what's important to you. What are you looking for? I mean, everybody wants to feel good, but that doesn't mean the same to everybody. Some people want to look good, so they just need plastic surgery. Some people want to sleep better. Some people want to be able to exercise. And so you have to listen to what they want. Anyway, some of them want their libido back. I mean, speaking of testosterone, that was one of the things that you could not fix with anything else. I mean, once you gave them testosterone, the libido came back and you never heard about it again. That was it. So it depends on what the patient wants. So most of the time we start with hormones, with thyroid, and if it's man, testosterone, but it would have to be like, I'll give you an example. The other day I say, a woman brought me her husband and she said, oh, he needs testosterone, I'm sure. And we did his testosterone level, and it wasn't that he needed testosterone, it was that his metabolism, the way he metabolized the testosterone, was kind of making it impossible for the testosterone to work. So here's a place where the blood test actually did help. And what we did is we gave him, a medication, as you know, that will change the way that testosterone gets metabolized. And the outcome was that he didn't need more testosterone. He just did fine. Immediately, he improved the situation and did not take testosterone. So it was very interesting that was his issue. So you have to kind of listen to the story and then put it together. But most of the time, like if, as I said to you, you start with progesterone for PMS for women. When they're young and, everybody has PMS and they're trying to kill each other with the PMS. And the way you get rid of it is you give them some progesterone and all of a sudden the PMS goes away. The next thing is you start giving estrogen, but don't give people estrogen unless their estrogen levels are really low. And around menopause, and we see that all the time, and somehow it's not being taught, women's estrogen goes up first and then it goes down. So if you're going to give a woman estrogen when her estrogen is up, she's not going to feel better. And she's not going to do well, and she's going to gain weight, and just all kinds of weird things will happen. So you want to make sure that they need progesterone or they need testosterone. Testosterone will turn into estrogen. So if you give a woman testosterone, you'll wind up with much better results at the beginning of menopause, before they go into menopause, than you will by giving her estrogen only. And also give them progesterone and testosterone together, because you do want to balance. The other thing is thyroid. I mean, people don't talk about thyroid unless they're doing thyroid. And we find that everybody needs thyroid to a certain degree.
Mm-hmm.
And by the time they're in their 40s, they're taking all these estrogen, progesterone, testosterone, you know, what I was saying to you before, DHEA, pregnenolone, et cetera. And that wouldn't help. It wouldn't do, they wouldn't feel as great as they will the moment you give them a little bit of thyroid.
Yeah. Now, as far as thyroid, do you like the synthetic or the natural?
Well, they're all synthetic. So let's make it very clear that all hormones are synthetic. They're made in a lab. I'm sorry about the light here because
it's okay.
Sorry.
Changing.
Right. They made it because they're made in a lab. They're all synthetic.
Okay.
But by synthetic, we don't mean that they don't look molecularly identical to what our hormones are. So whether you're taking estradiol, that is natural estradiol or bioidentical estradiol or FDA approved estradiol like estrogel, they're all exactly the same active ingredient. They're synthetic, they're made in a lab, and they look molecularly exactly like what your body makes.
Mm-hmm.
Testosterone, the same thing. It's all synthetic. It's made in a way that looks identical to what your body makes, but then it's made in a lab. The same thing about thyroid. So we have the Armour thyroid, which used to be the gold standard thyroid for people who weren't doing conventional, traditional medicine. Mm-hmm. And then you had Synthroid or levothyroxine, which is T4, and Cytomel, which is liothyronine, which is T3, that were considered synthetic, and they came, from the pharmacy. The truth is that T4 and T3 are exactly what is being compounded in the lab. So it's the same thing. It's not like you're getting synthetic versus non-synthetic. It's all the same. The thing is that T4 needs to turn into T3 to be active, to actually do anything in your body. So you don't have to wait for your body to sit there and turn it into T3. So it turns out that if you take T3, which is liothyronine, and you take that when you're young or old, like at both extremes, you don't really need T4. So you could do fine with liothyronine alone. Just don't take too much of it. And the thing is that, again, the American Endocrine Society doesn't seem to know anything about that because they're working in disease while we're working in health. So they're not going to prescribe it. I see patients all the time. I don't know how that happened, but I see women who have, and men, primarily women, who have had thyroidectomies. So they've had their thyroid removed. They're given T4, Synthroid, or levothyroxine. It never works. They never get their energy again. They have brain fog. They feel horrible, and they get obese. They have there's no joie de vivre left, right? And these women, all they need is T3, but they're not given T3 because the American Endocrine Society does not say you should give women T3. Mm-hmm. So that's a problem because every time you give somebody T3, they feel better.
Okay. So when do you incorporate peptides after you get everybody's hormones all settled in?
Well, it kind of depends on the patient. So peptides, we work with growth hormone release peptides, right? So what they do is they work on your pituitary and they tell your pituitary to release growth hormone, which obviously is something that you're not going to be making a lot of when you're getting older, but putting it in, somehow your pituitary will make it again. And so that improves your metabolic rate, that improves your body's ability to build muscle. So it's a wonderful thing to do, to give people this really panacea. Now, if you give people growth hormone alone, which is what is given to people who have either, hypogonadism because they were just born with it, or the young people who won't grow and they get growth hormone. The problem with it is that it's only one specific type of growth hormone. If you're giving them peptides like growth hormone releasing factor, like ipamorelin and GHP, what happens is the problem is that your body will make the kind of growth hormone that it would ordinarily make, which is not one piece of growth hormone, it's all the pieces of growth hormone. So the results are amazing. The problem with peptides is that it's expensive. So if you're going to get the real peptides, because there are a lot of advertising which is not honest, which tells you that you could take, in a spray or a pill, or, there's a new drug that just was passed through the FDA for testosterone, which to me it's an oral testosterone pill. And I'd like to know how that works, because it doesn't work. And it got FDA approval. And like with peptides, the problem with peptides is that they're expensive. And you need to work with someone who actually knows peptides. And there's not that many people who know peptides, because peptides come from, the guys that were doing it at the gym and they were building muscle, and it's to build. And peptides are amazing. I mean, I find peptides as being like miraculous, the same way I found hormones as being miraculous. I find them as being miraculous because it helps people, and people, their immune system is boosted. I mean, and we follow them. We do T cells on them, and we follow and see how the immune boost, thymosin alpha, for instance, thymosin beta, like for soft tissue repair. We work with patients who have surgery, and before the surgery, we start them on peptides. They go through the surgery with the peptides, and then after the surgery, they recover at literally 90 miles an hour, and it doesn't matter how old they are. And then the orthopedic surgeon who's done, let's say, the hip or whatever the surgery is, will always be amazed as to how did this happen. And you can explain it to them, but it's not something they're taught. So the thing with peptides is you can cycle them, so you don't have to spend, your last dime on them. So you don't have to use them all the time. But if you know how to use them, they will really protect you. They're anti-inflammatory, they're immune boosting. They help people like who are treated for cancers, let's say, to kind of decrease and eliminate some of the symptoms, side effects of chemotherapy. So there's a lot of really beautiful stuff you can use with peptides. You can do with peptides.
Sure. And then stem cells.
Yes.
Tell me, do you use stem cells in your practice, and how do you decide because you got so many tools, how do you decide? And I know you go back to the patient, but but the patient's looking to you for guidance. Right. So how do you guide someone through that process?
Depends what the problem is. So we used to use peptide. We used to use stem cells, and we used to use stem cells that were adipose stem cells. So they would be from the patient, autologous. So they would come from the patient, and we used we used to take it from various areas where they would have some fat, and then they would go through the process and clean them up. Well, apparently that was not something that the FDA was really into. So we started working with people at HSS, which is in the city, and they are doing it from the bone marrow, and they take it out of the bone marrow, and then they use the same process, and then they re-inject them in the area that's needed. So it's usually an orthopedic surgery situation. The thing is that you can use them systemically, but the data on it is not strong enough, and it's not, I mean, it's great in mice, but it's not enough in humans. So to get them into humans is really what you need to see. There's no question that stem cells will work, especially if they're alive and if they're not dead. So there are people who give them to patients, and I see it in the city all the time, who give them from like sheep, and who knows what kind of other stem cells they got from umbilical cord. And there's a lot of stem cell, research going on. We're not using it in our patients. What I do is I refer them, and especially for, combinations of like orthopedic procedures. But you always do it with PRP. So they do it with PRP. We work with some really great people at HSS who are using it with PRP, and they're doing a lot. They have an IRB, and they're doing research on it, and it's great results.
Sounds wonderful. Sounds wonderful.
Yeah, well, you told me at the beginning that you were using PRP long before anybody even knew what it was.
Yeah, I was using PRP in periodontal surgeries for bone grafts and soft tissue grafts. And that was actually before now there's all sorts of fancy centrifuges, but we have to get ours from a hospital perfusion machine.
Right. Interesting. We use PRP in facials, and we do a lot of, we have an aesthetics department at Evolve Science, and PRP is used a lot, and it works spectacularly. It's beautiful. I mean, I don't understand why anybody would have a regular facial with some, skin stuff that doesn't work when you can use PRP, which does work.
Yeah. No, PRP is pretty amazing. The first time I saw it was a MD DDS oral surgeon who's treating rebuilding people's jaws post-cancer resective surgery. Okay. And the difference with PRP and without PRP was just like phenomenal. So it's pretty interesting.
Well, recovery is unbelievable. But when you think about that, and when you ask about using PRP, using hormones, using peptides, you see the recovery in these patients. I had a patient who tore her hamstring, and she went and had surgery to have the hamstring repaired. And she had been a patient in the practice for many years. And most of the patients have been in the practice for many years because they never leave, because we learn something new all the time. And this patient recovered literally in 2 weeks from this really serious surgery. And she went to the surgeon. The guy said, well, what did you do? And she said, well, I was getting this IV and I was doing this and this. And he said, whatever it is. Wouldn't you want to know what it was? Wouldn't you pick up the phone and call me and say, hey, let me ask you, what are you doing? Because I want all my patients to do this, to recover like this.
Well, I mean, to a certain extent, surgery is very mechanical.
Well, that's a very kind way to say it.
Yeah, well, I mean, I'm not going to trash myself. I mean, I used to be a surgeon, but I knew. But it is very much. It's very technique sensitive, and it's also very mechanical. And I think there's a disbelief that you can take this PRP and put it in, and it's going to make a difference. I mean, it's just but it does. But it does. It's amazing. I mean,
what's interesting if you think about it. These people who go in, and now the insurance companies are reimbursing according, to results. So if your patient is doing better and is out of the hospital at 48 hours versus this patient who's lingering for a week, you should know what it is.
Yeah.
You should want to have your patient do better, right?
Yep.
I'm with you. I don't know.
Yeah, it's interesting. Well, I want to thank you for coming on the program.
My pleasure. Anytime.
And we'll probably have you back on. We'll figure out something else that we can talk about, and we'll go from there. But thank you.
Thank you so much for having me on your program.
This is Urs, the old guy from oldguytalkstome.com. And before you stop listening to me, I want you to do several things. I want you to subscribe, share, rate, and review. And if you give me a poor review, that's fine too, because I love my trolls. I love you. Engage with me all the time as much as you can. Until next time. Thanks for joining me on this podcast. If you like what you heard and learned, then be sure to do 3 things. 1, subscribe so you don't miss the next episode. 2, share this with someone who may need to hear it also, and it may be your significant other. And 3, review it. Give me a good review. If you didn't like it, give me a bad review. I don't care. Just review me. And be sure to get my free video on 3 ways to get laid more frequently without begging. Opt in at oldguytalks.com. Don't be that guy that just takes in the information. Take action. Without action, you're not going to get the results you want.